watching the handling of the COVID-19 infection within the meat industry over the last number of weeks. And it gives me no pleasure to say that I'm very seriously concerned by the manner in which this particular infection is being managed. And I have a genuine fear that if this continues next week with the reopening of the economy, that we could be looking at a resurgence of this virus. Minister, we have a serious problem within our meat plants, which should come as no surprise because this is a global problem that has sadly been replicated here in Ireland, and our response to this can at best be described as lethargic. We are now looking at clusters of infection surrounding meat plants where the levels of infection within the plants themselves is up on 1/3 or in some instances half of the workforce. This seriously brings into question the COVID protection measures implemented in these plants. And yet, despite this, the Minister for Agriculture assured me here in the Dáil just 2 weeks ago that he was satisfied from the feedback from his officials in the meat plants that everything was being done to minimise the spread of this infection. What surprises me is that even though we had a problem in nursing homes because of delayed actions, the same was allowed to happen within our meat industry. So, Minister, why did it take 6 weeks after the first infections in plants before screening of all staff took place? Why has it taken up to 2 weeks to return test results to some meat plant employees if there was no backlog with testing? Why were staff not instructed to self-isolate in the interim while awaiting those test results? Instead, they returned to work the very next day into meat plants where public health doctors were concerned enough with the scale of infection to order testing of every employee. Because of this failure to self-isolate staff, who potentially showed no sign of infection, they could have been spreading the infection asymptomatically, and this has now resulted in a situation where the negative results issued to employees are worthless, as they could have become infected in the interim period by employees who were asymptomatically positive while awaiting test results. We have serious lessons to learn from the manner in which testing and the delivery of results have taken place in our meat plants. This is also the case in our nursing homes, where staff have been waiting up to 3 weeks for results. These delays have seriously undermined the value of the screening process. So will the Minister ensure that all residents and staff are retested immediately and the results issued in a timely manner? This also needs to be done in the meat plants, and staff instructed to self-isolate until they have received a clear result.
Thanks very much to Deputy Naughten. Just firstly, in relation to the issue of the nursing homes, I'd very much welcome, and indeed he may have corresponded with me, but I'd very much welcome the details of those nursing homes, and I'll revert to him directly in relation to that. I'm holding twice weekly meetings with Nursing Homes Ireland and with the HSE's National Director leading on this, with the specific aim of those meetings to be to identify any difficulties, be it in terms of PPE testing or the likes, and I'd be very happy to engage with Deputy Naughten on that. In relation to when nursing home residents and staff will be retested, and indeed when many priority groups will be retested and the schedule for that, NEFIT has asked the Health Service Executive to put in place a testing plan in that regard, and I want to go back to nursing homes next week and be able to outline to them when they can expect further testing. And also, I know a number of them are eager that they can do the testing themselves, which I think will further streamline the process rather than requiring the National Ambulance Service to go there. But I'll engage directly with the Deputy in relation to the issue of nursing homes. On the issue of meat factories, I want to thank Deputy Naughten for raising this. As the Deputy rightly knows, that this was obviously, this industry and food production was deemed an essential service. It was also decided where essential work cannot be carried out other than in a workplace setting such as in a meat plant, employers are required to have protocols in place for the protection of their employees, and these protocols have been put in place, and examples could include things like protecting employee safety, for example, through the reduction of throughput rates of the plant, the extension of operating hours and other safeguards such as the checking of temperatures of people entering the plants, the provision of additional PPE, the use of Perspex screen, and the provision of additional facilities to support physical distancing measures. Where cases of COVID-19 do arise, the employers engage with the HSE and typically a local outbreak control team is set up. On foot of a number of clusters arising in meat plants, a national outbreak control team was established on Thursday the 7th of May, with further meetings planned. This group will oversee and coordinate the approach to COVID-19 outbreaks in meat plants in Ireland, and as part of its output it will issue guidance documents to all meat processing facilities. But I think the Deputy raises a very serious point. There are approximately 250 veterinary and technical staff within the Department of Agriculture involved in supervising and regulating the operations of 56 slaughter plants and a large number of meat processing plants as well. I know that Minister Creed has had ongoing engagement with Meat Industry Ireland. I know he met them on the 5th of May. The Minister did acknowledge the efforts made to date, but he did emphasise that the meat industry should proactively take any additional measures necessary in order to continue to mitigate the risk of COVID-19 for all workers as well. And I do want to say this, whether you're an essential business or indeed one that may open in the future, you do have a very clear responsibility in terms of public health. And no matter who you are, no matter what business you own, no matter how important it is deemed to be by society, the National Public Health Emergency Team and others issue public health guidance, and it is absolutely the expectation that that guidance needs to be followed. And indeed the measures announced by Minister Humphreys the other day are very clear in relation to the enforcement that can be taken if those measures aren't in place.
Minister, the only conclusion that I can come to is that the delays that I have outlined to you are being used to wallpaper over the gross system failures, particularly in contact tracing. We have been informed as public representatives by the Health Service Executive that people are being given results within a day of their return from the laboratory, and those who are positive are being contacted directly by a health professional. This is not happening, and negative results are being long-fingered for days and possibly weeks. In fact, the system is so bad that employers are being provided with a list of test results directly, and they are the ones informing employees as to whether they are positive or negative for COVID-19. So will the Minister now confirm that medical data is being shared with employers before employees, and explain to me why this is happening? And can I say to you, Minister, if you think the initial communication of test results is bad, the follow-up contact tracing is at best intermittent and, from my experience, is failing fundamentally.
I think we need to be very clear and honest in relation to this pandemic. There's no doubt that there are always areas in which we must continue to improve. But the difference between this government and other governments in different jurisdictions is when the challenge gets difficult, we don't walk away from the challenge. So in many countries, you would not get a test for COVID-19 unless you're in a hospital setting. In many countries, they're not doing community testing. They're not recording what we're recording. We are proactively seeking to find this virus in every possible scenario we can in the community at large, and we've seen the success in that regard in terms of the suppression of the virus so far. But now also identifying areas of particular challenge and difficulty, be it the nursing homes and the progress that we've now seen being made there as a result of the very significant effort in testing by many staff and people in the HSE and in HICWA and other places. But also the Deputy's right to highlight in certain workplace environments as well. We have a capacity to do 100,000 tests a week from next week. That will ensure that there's capacity to test people who are symptomatic, to test their close contacts, but also to target that testing then at other groups where there might be a vulnerability in terms of the virus spreading. The Deputy is right, though, about the need to further tighten up turnaround times. Absolutely he is. It was a challenge in relation to capacity. It's now a challenge in relation to turnaround times. HSE made very clear comments in relation to that today in terms of the end-to-end referral to contact tracing completion in less than 3 days in 90% of positive cases from next week, acknowledging that there will always be some cases, that remaining 10%, which will be more complex in terms of contact tracing and management, and a target of a swab to result in less than 2 days, which of course will account to the majority of people where there will be a negative result, currently at about 97% of tests. And finally, I don't have information in relation to that issue of patients' details and employers, but I'm very happy to receive it and revert.
I'll give it to you, Minister. What we have is playing with figures here. And you've said there that 90% of those that are positive will be contacted within 3 days. I've outlined to you a fundamental problem with the negative results, which is leading to a situation that people are not self-isolating and there is contamination and people being infected as a result of that. The system is not working. Minister, now I'm not attributing blame in relation to this, but to keep that agricultural theme, the reality is that TDs are now being fed organic fertiliser. And as long as this happens and we're not being given the truth, public confidence in the management of this pandemic will be seriously undermined. And after such heroic efforts by every citizen in this state to stop the spread of this virus, we cannot allow, under any circumstance, a second wave of infection. But you cannot ask people to continue to make such efforts if the truth is being hidden from them in relation to the consistent delays in contact tracing and informing people of their actual result.
I know the time is gone. I'm not ever sure in my time in this House there's been a greater level of engagement between deputies, be they both on the floor of this stall where I take questions for 2 hours a week every week along with a range of other government ministers in the Taoiseach, a special committee dedicated to the issue which will meet next Tuesday, and a range of briefings provided by HSE leadership, the Taoiseach, the Chief Medical Officer and others. Certainly an effort to always answer questions and to honestly exchange. But I'd like to take any details Deputy Naughten has and revert to him on that.
Naughten, that information in respect of test results was going to employers before it went to those who had been tested would be of fundamental concern to the public, and I think does need to be addressed.
Sorry, Councillor, I very clearly said that Naughten has made that comment on the record of the House. I've asked him to provide me the details.
It has happened in a number of instances across the
but I don't have that detail, so I don't intend to comment on it.
Now, Deputy Matthew McGrath.